Renal cell carcinoma (RCC) is an renal disease. Look at this picture, shows that renal cell carcinoma. Ultrasound findings. Look at this. CT scan and MRI findings. Look at this. Detail going on. Introduction. Renal cell carcinoma is the most common type of kidney cancer, accounting for about 85% of kidney cancers. It originates in the lining of the renal tubules and tends to be aggressive. Often presenting without symptoms in the early stages, RCC typically affects adults, particularly those between the age of 50 and 70, and can lead to significant morbidity and mortality if not diagnosed and treated early. Etymology. The term renal comes from the Latin word renals, meaning pertaining to the kidneys. Cells refers to the smallest structure and functional unit of an organism. Derived from the Latin word cellula, meaning a small room or compartment, reflecting the tumor's origin in the kidney cellular structures. A definition. Renal cell carcinoma is a type of cancer that starts in the cells of the kidneys, specifically in the renal tubules. It is characterized by the uncontrolled growth of malignant cells in the kidney, which can spread to other parts of the body through the bloodstream or lymphatic system. Types. There are several subtypes of RCC based on the appearance of the tumor cells under a microscope. 1. Clear cell RCC. The most common form of RCC, comprising approximately 70 to 80% of cases. It is characterized by cells that appear clear due to the loss of cellular components. Two, papillary RCC. The subtype accounts for about 10 to 15% of RCC cases. It forms in the lining of the renal tubules and often appears as papillary, means finger like projections. 3. Gramophobia RCC, a rare subtype accounting for about 5% of RCC cases with cells that appears darker under the microscope. 4. Collecting duct RCC, a very rare and aggressive subtype that originates in the collecting ducts of the kidney. 5. Unclassified RCC, a category of RCC that does not fit into any of the above classifications. Causes. The exact cause of RCC is not fully understood, but several factors are believed to contribute to its development. 1. Genetic mutations. Specific genetic changes such as alterations in the one Hipple Lendu BHL gene have been linked to RCC. 2. Environmental factors. Exposure to certain chemicals or toxins, including smoking, may increase the risk. 3. Chronic kidney diseases. People with long term kidney disease, especially those on dialysis, may have a higher risk of RCC. 4. Obesity, a high blood pressure. These conditions are associated with an increased risk of RCC. Risk factors. Several risk factors can increase the likelihood of developing RCC. 1. Smoking. Smoking is one of the strongest risk factor, contributes to a significant proportion of RCC cases. 2. Obesity. Excess body weight is associated with higher level of growth factors which may promote the development of cancer. 3. Chronic kidney disease. Individuals with kidney disease, especially those undergoing dialysis, have an increased risk of RCC. 4. Hypertension. High blood pressure may contribute to the development of kidney cancer. 5. Family history. A family history of RCC or certain genetic conditions such as von Hippel Lindau syndrome can increase the risk. 5. Gender and age. RCC is more common in men, typically occurs in individuals over the age of 50. Complications. RCCs can be lead to various complications if left untreated. 1. Metastasis. RCC often spread to other organs, particularly the lungs, bones, and liver, leading to further complications. 2. Renal failure. Advanced RCC can affect kidney function, leading to kidney failure. 3. Anemia due to the production of erythropoietin by RCC. Some patients may develop anemia. 4. Obstruction of the urinary tract. Tumors can block the urinary system, causing hydronephrosis or kidney damage. Pathophysiology. The pathophysiology of renal cell carcinoma involves the following steps. 1. Genetic mutations. Second step, disruption of normal cell function. 3. Angiogenesis. 4. Inversion of local tissue. 5. Metastasis. 6. Renal dysfunction. 7. Immune evasion. 8. Secretion of hormones and cytokines. RCC tumors can produce various substances including erythropoietin, which stimulates red blood cells production, and parathyroid hormone related protein PTHRP, leading to symptoms like anemia, hypercalcemia, and increased blood pressure. Now, in tumor progression, over time RCC may progresses from localized tumor to a more advanced stage with widespread metastasis, making treatment more difficult and reducing the chances of successful management. These steps described how RCC develops from genetic mutations in kidney cells to widespread metastasis, ultimately leading to kidney dysfunction and other systemic effects. Signs and symptoms. RCC may present with variety of symptoms, although many cases are asymptomatic in the early stages. 1. Hematuria, blood in the urine, often visible as red or dark urine. 2. Flank pain, pain in the side or lower back, often sign of tumor growth. 3. Palpable mass, a lump mass that can be felt in the abdomen or flank. 4. Unexplained weight loss, unintentional weight loss associated with advanced RCC. 5. Fatigue, a general feeling of tiredness or weakness. 6. Fever, a low grade fever which may be intermittent. 7. Hypertension, high blood pressure due to increased production of hormones like renin. 6. Anemia, low red blood cells count due to impaired erythropoietin production by the tumor. A diagnosis. Diagnosis of RCC involves a combination of imaging studies and laboratory tests. 1. Ultrasound, often used as an initial screening tool to detect renal masses. 2. CT scan. Provide detailed images to assess tumor size, location, and extent of metastasis. 3. MRI. Used for further evaluation of renal masses and assessment of potential spread to surrounding tissues. 4. Biopsy. The tissue sample may be taken to confirm the presence of cancer cells. 5. Blood test. Test like complete blood count CBC, liver function test, and kidney function test can help assess the extent of disease. Nursing diagnosis. Nursing diagnosis for patients with RCC may include 1. Impaired renal function related to tumor obstruction and inversion of kidney tissue. 2. Pain related to tumor growth, metastasis, or surgical interventions. 3. Anxiety related to the diagnosis and uncertainty of treatment outcomes. 4. Fatigue related to disease process or side effects of treatment. 5. Risk for infection related to immunosuppression from treatment. Example, chemotherapy or surgery. Management. Medical management. 1. Surgical treatment. Nephrectomy is the most common surgical option for localized RCC. 2. Targeted therapy. Drugs such as tyrosine kinase inhibitors and immune checkpoint inhibitors are used for advanced RCC. 3. Chemotherapy. Although less effective for RCC, it may be used in some cases. 4. Radiation therapy can be used for metastatic RCC or to relieve symptoms in advanced cases. 5. Immunotherapy involves stimulating the body's immune system to attack cancer cells. Nursing management. 1. Pain management. Administer pain medications as needed and monitor the patient's response. 2. Fluid and electrolyte balance. Ensure people hydration and monitor renal function and electrolytes. 3. Emotional support. Provide counseling and support to help patients cope with the emotional impact of the diagnosis and treatment. 4. Monitor side effects of treatments, which for adverse reactions from chemotherapy, radiation, or targeted therapies. 5. Post-operative care. Assist with recovery after nephrectomy or other surgical interventions. Treatment options. 1. Surgical treatment. Nephrectomy Removal of part or all of the kidney is the primary treatment for localized RCC. To targeted therapy, medications like tyrosine kinase inhibitors or M.TOR inhibitors can help control tumor growth in advanced RCC. 3. Immunotherapy. Immune checkpoint inhibitors or cytokine therapy can be used for advanced or metastatic RCC. For radiation therapy, primarily for palliative care in metastatic cases to relieve symptoms. 5. Chemotherapy. Not typically effective for RCC but may be used in combination with other treatments. Psychosocial medicine. 1. Counseling. Provide individual or group therapy to address the emotional impact of cancer diagnosis and treatment. 2. Education. Educate the patient about RCC and treatment options and lifestyle changes to manage symptoms. 3. Stress management. Often relaxation techniques such as deep breathing, meditation, or mindfulness. 4. Support groups. Encourage participation in cancer support groups to connect with others facing similar challenges. 5. Caregiver support. Provide resources and support for family members or caregivers who are helping manage the patient's care. Prevention. While RCC cannot be entirely prevented, certain measures may help reduce risk. 1. Quiet smoking. Smoking cessation reduces the risk of RCC and improves overall health. 2. Maintain a healthy weight. Preventing obesity through proper diet and exercise can help lower the risk of RCC. 3. Control hypertension. Keeping blood pressure within healthy range reduces the risk of RCC and improves kidney function. For regular medical checkups, monitoring kidney function and addressing risk factors such as chronic kidney disease can help with early detection. In conclusion, renal cell carcinoma is a serious and often aggressive form of kidney cancer. Early detection and treatment are crucial for improving outcomes and advancements in surgical techniques. Targeted therapies and immunotherapy have improved survival rates in recent years with proper management, including pain control, emotional support, and adherence to treatment protocols. Patients with RCC can maintain a good quality of life even during treatment. Thank you. Have a nice day.